Transaxillary Endoscopic Thyroidectomy. Hello. This is an educational video designed to improve your understanding and overall experience for your surgical treatment of thyroid cancer. Please pay attention to the following materials for your safety and optimal treatment results. Background and indication for surgery. Thyroid gland is a butterfly-shaped hormonal organ located at the front of your lower neck, which is divided into left and right lobe, isthmus and pyramidal lobe, and the gland secretes thyroid hormones which regulate many metabolic functions in your body. Transaxillary endoscopic thyroidectomy is a hidden scar operation, where an incision is made along the armpit skin fold for an endoscopic operation. Compared to the conventional open thyroid surgeries, transaxillary endoscopic surgery leaves no neck scars, conferring great cosmetic benefit. Please talk to your doctor if you qualify for transaxillary endoscopic thyroidectomy. Surgical procedures. Once the patient is under the general anesthesia and properly prepped and positioned for the surgery, a single incision will be made on the armpit to create a working space for endoscopic instruments and camera. Your surgeon will carefully expose and dissect the thyroid gland from the surrounding tissue. Depending on the tumor location and size, partial or total thyroid gland may be resected. If indicated, surrounding neck lymph node may be removed as well. Once the thyroid gland is removed and all bleeding is appropriately controlled, the wound is closed with a temporary drain in place to monitor and minimize any fluid accumulation underneath the skin. Subsequently, the skin incision is closed with a suture. Post-operative care. To avoid breathing complications after the surgery, patients are encouraged to perform deep breathing and coughing exercises. As the anesthesia wears off, patients may experience pain along the surgery site, sore throat and neck stiffness secondary to the breathing tube placement and neck positioning. However, these symptoms are often well tolerated with pain medications and often resolve in few days. If a drain was placed, it is routinely removed prior to discharge once the output had decreased and the drainage has cleared. Please be careful not to accidentally dislodge the drain or kink the tubing while sleeping or moving. Complications of surgery. Bleeding. Your neck has abundant blood supplies with extensive blood vessels, and despite a meticulous effort for a good bleeding control during the operation, it is possible to have a delayed bleeding complications. Bleeding in the neck can pose a serious breathing problem if it forms a hard and tense buildup of blood, which can lead to swelling and obstruction of the airway. Immediate intervention is required to evacuate the blood and to control the source of bleeding. Wound complication. Creating a skin flap on your upper chest and neck may form a bruise, which usually resolve in few weeks. Post-operative pain is generally well tolerated with pain medications. Few percentage of patients experience altered skin sensation over the chest and neck area, which usually resolves in few weeks to several months in rare cases. These side effects relating to skin changes are easily accessible, and they are often self-resolved over time without any specific treatments. In addition, in rare cases, skin adhesions along the skin flap area may cause abnormal wrinkling and pulling. This problem can be usually prevented by performing a post-operative neck exercises as shown. Nerve injury. Your left and right recurrent laryngeal nerves, which innervate vocal cords for phonation, traverse adjacent to the trachea right under the thyroid gland. Although preservation of recurrent laryngeal nerve is the key principle in thyroid surgery, some patients experience nerve injuries which often resolve in few weeks to months. Rarely, a permanent injury may occur. In an advanced cancer operations, the nerve is sacrificed if involved with cancer. Some patients may not experience much symptoms, but certain patients may complain about voice change and breathing difficulties. Surrounding tissue injury. Since the thyroid gland is surrounded by major vessels as well as digestive and airway structures, these organs can be injured during the operation. Hypothyroidism. Thyroid hormones stimulate metabolism in your body and thus, elevated thyroid hormone level causes symptoms of hyperthyroidism, while diminished level causes symptoms of hypothyroidism. Once the entire thyroid gland is removed, no thyroid hormones are produced in your body, and therefore thyroid hormone replacement therapy is required to prevent hypothyroidism, and also to suppress thyroid cancer recurrence. Hypoparathyroidism. There are 4 parathyroid glands that regulate your calcium level in your blood, located on the back surface of the thyroid gland. During the thyroid operation, these glands can be injured, which may lead to transient or, in rare cases, permanent dysfunction of parathyroid gland, leading to low parathyroid hormone production and subsequent low calcium level. Lowered calcium level can lead to numbness and tingling of your hands and around your mouth, as well as muscle spasms in more severe cases. These symptoms are treated with calcium and vitamin D supplements until the parathyroid gland recovers. Possibility of cancer. Fine needle aspiration biopsy is the gold standard for diagnosing thyroid cancer prior to operation. However, the fine needle aspiration biopsy is not always accurate. A pathology evaluation from a resected thyroid tissue will provide an ultimate diagnosis, and depending on the result, one may require an additional surgical or medical treatment. This concludes the Transaxillary Endoscopic Thyroidectomy educational video. Thank you.